Talk about big new changes for the childhood immunization schedule. This dropped yesterday. The CDC is dropping the recommended 18 vaccinations down to 11 instead. Officials say this is more in line with other developed countries like Denmark, which targets just 10 diseases. The shots that have been nixed include COVID-19, flu, Hep A and B, RSV, rotavirus, and meningitis. But critics worry that the changes will cause more confusion and possibly even lower vaccination rates that could end collective herd immunity. Joining me now is CDC former acting director and the president and CEO of Robert Wood Johnson Foundation, Dr. Rich Besser. He is also a pediatrician. Doctor, good morning, and thank you for your time.
Good morning. Very nice to be here.
You released a statement. I'd like to read this, if we could pop this up, guys. You said in part, quote, Secretary Kennedy has said that people should not take medical advice from him. This announcement shows exactly why that's the case. Explain to me just your thoughts and why you think these recommendations are dangerous.
You know, one of the things about Secretary Kennedy, before he became secretary, he was one of the nation's leading anti-vaccine advocates, and I think did more than just about anyone to undermine people's trust in vaccines. You know, I practiced pediatrics for more than 30 years and spent a lot of time talking with parents so that they had the information that they needed to make the right decisions for their children. Yeah. And to a person, they ended up wanting to make sure their children were vaccinated fully and on time. And when I look at the list of diseases that are no longer recommended for vaccination, for most of those diseases over the course of my career, I saw hundreds of children hospitalized, and I've seen children die. And the idea, you know, when each of these vaccines came available, to me, it was almost miraculous that we no longer needed to worry about children getting dehydrated from rotavirus, and babies being in the hospital with RSV, and parents having to suffer as their children were struggling with meningitis. And the idea that we're going back to the pre-vaccination era for those diseases is really, really troubling to me.
What do you make of the timing of this, doctor? Just kids going back to school after the holiday break. I believe there have been 9 child deaths so far this season from the flu. We just had one in Illinois here. What do you make of the timing? Why this came down now?
Well, I mean, this is something the secretary's wanted to do for a long time. He already gutted the committee that advises the CDC on vaccine recommendations. But this was just a wholesale swoop of changes that came not through a careful review, but it came really through his political appointees looking and saying, what can we do to eliminate more vaccines? These vaccines are still available. So parents, you know, I want parents to know they can go to their doctors and say, you know what? I want to learn about these vaccines so I can make the right decision, and hopefully they'll decide to get vaccinated. But this is the biggest change to our vaccine schedule in my lifetime.
Yeah. And what do you tell parents who, you know, I'm a mom, I have 2 under 2 at home, so I'm in the thick of every appointment you go and it's 2 or 3 shots. And, you know, I've listened to my pediatrician, but you pray to God you're making the right choices for your kids. You know, for families at home who don't know who to turn to, they're confused by this. What's your guidance there for moms and dads?
Yeah, I mean, it is hard. It is really hard for parents with young children. If you're fortunate to have a doctor, a nurse practitioner, a pharmacist, someone you trust, talk to them. Express your concerns. Make sure you get all of your questions answered. That's the best way to go. If you can avoid the political swirl that's going around vaccines and focus on that relationship you have with a healthcare provider, that's definitely the best way to go.
Dr. Richard Besser, thank you so much for your time and expertise this morning. Have a great day.
You too. Thank you.
Hope to have you back soon. All right.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.